Well, good afternoon, everyone, or should I say good morning, or maybe good evening. Watching the chat go by, it looks like we've got folks from Maryland to Myanmar on the call today, which is really exciting. We have, I believe, participants from all 50 of the American states, and I know that we had about a dozen other countries who were registered around the world. So wherever you are watching from, boy, are we ever grateful that you took time out of your busy schedule to join us here today for the debut installment, our very first installment of a new webinar series from the Saul Zaentz Charitable Foundation that we are calling Meeting the Moment. My name is Dan Wuori. I am an educator, an author, an occasional social media dabbler. But among my very proudest titles, I will tell you, is that I serve as a strategic advisor on early childhood to the Saul Zaentz Foundation. If Saul's name isn't familiar to you, by the way, his work almost certainly will be. Saul led a really extraordinary life. He wore many hats, but is perhaps best known as a film producer, and a film producer with not one, but three different Academy Award winning Best Pictures to his credit. One Flew Over the Cuckoo's Nest, Amadeus, and The English Patient were all among the films that Saul put his stamp on. The foundation carries on his important legacy with investments in early childhood education and homelessness, just to name a few. And so we thought, what better place to launch this series than sort of at the intersection of the two, and to have some conversation around the impact of homelessness on young children and their families. When you think about homelessness, you may conjure up for yourself, some very specific mental images, but in truth, the definition of homelessness may be a bit broader than maybe you initially think. Indeed, there was a 2021 study that found that as many as 1.3 million infants, toddlers, and preschoolers, so roughly 1 in 18 children under the age of 6 during that year, experienced homelessness in the United States. And so, to help us to unpack this important topic, we have a truly stellar panel with us today, beginning with Dr. Jack Shonkoff, who many of you know as the founding director of the Center on the Developing Child at Harvard University. Jack is the current director of Connecting Science and Community, which is a recently launched initiative focused on the intersection between early childhood science, direct services for children and families, and community revitalization. We are also joined today by Erin Patterson, who is the Senior Director of Strategic Initiatives and Partnerships at Schoolhouse Connection, and her colleague, Sarah Vrabik, who is the organization's Senior Manager for Early Childhood. And also, we are joined by Teresa Calderon, who is the manager of the Glide Family Resource Center, which is a ministry of Glide Memorial Church in San Francisco, California. So we are so glad to have all of you with us. As we kick into this conversation, we do have one minor but important sort of housekeeping note. Later in the hour, we're going to turn to you and pose questions of the panelists that that maybe you would like to have asked. If you have a question for the panel as we go through the hour here, would ask if you use your mouse and hover over the bottom of your Zoom screen. You should see a Q&A function there. And if you would drop your questions there, as opposed to the chat. We encourage you to use the chat throughout the hour to converse with one another. But in terms of questions, you'll notice already that the chat can move fairly quickly. We don't want your questions to get lost in the shuffle. So if we can keep the questions for the panel in the Q&A as opposed to the chat, then later on in the hour, we will pull from those to have some additional conversation inspired by your questions. And so with that, why don't we kick into gear? And Jack, I wanted to start with you. As both a pediatrician and as the founding director of the Center on the Developing Child. I thought that you could lend some really important insights as to how homelessness influences both the brain and early development more broadly. I know in recent years you have spoken a good bit about what you call early childhood development 2.0, which in part looks at, one, sort of connecting the brain to the rest of the body, two, the effects of both those important adult-child relationships, but also the broader environmental influences on children's health and development, and three, the need to focus on variation in sensitivity to the environment when it comes to early development. So maybe as we kick things off, Jack, could you help us to unpack a little bit about what those three concepts mean, and in particular, what do they mean? What are their implications for this conversation about homelessness in particular?
Yeah, thanks very much, Dan, for the invitation and to be joined by my colleagues on the screen. So your question really kind of sets up a nice opportunity to recognize that what we think of as science-informed policy and practice um, needs to be expanded in terms of what we think science has to say. And I think the fact that these questions always start with a focus on brain development, child development, is really important because that's been something we've been focusing on for a long time. So when we look at homelessness, and let's use homelessness as our focus, a very important question is, aside from kind of meeting basic needs in a very difficult environment, how are we promoting healthy brain development and healthy early learning and foundations for school readiness, which is kind of the way the field has generally been thinking. And so what I'm going to do in a couple of minutes now is to kind of elaborate a little bit on what we mean by the science of ECD 2.0, because the science, the underlying biology in particular development, has been really moving very rapidly, and there's a lot of new knowledge that has not been incorporated into what we do. So we'll just talk about homelessness now, but this really applies across the board to all threats to healthy development. So I think the first thing to recognize is that anything we might focus on related to learning, behavior, physical health, and mental health, all of them are influenced beginning very early, in fact, before you're born, but let's just start with after birth, by the interaction among three influences. The first is the environment in which children are growing up. We've tended to define the environment by the family and focusing mostly on adult-child interactions and relationships. Clearly, they remain critically important. There's no science that says that's not important. It only reinforces it. But a lot of science that says we can't stop there. It's not just about adult-child relationships. It's about the broader environment in which adults are raising children. So obviously the homelessness issue looms large here. I'll say a little bit more about that in a minute, but that's only one influence. The other influence that we've paid less attention to, but everybody understands it in real life, is that each of us, unless we have an identical twin, has a unique genetic makeup. And within a wide range of normal variation, we're not all the same in our sensitivity to the environment, right? So when we think about the interaction between environmental experiences and exposures and individual differences in children, then we have to immediately move beyond just generalizing. So what do we know about homelessness and its effect on children? Well, we know it's bad. We know it's a huge challenge, but how it affects children varies, not just in terms of how well they're cared for, but how they are variably sensitive to what's going on around them. And that leads to the third concept, and thanks for teeing up the framework for my comments, is that also when things happen is important. So the effect of the environment and individual responses when you're 2 months old is different from when you're 10 months old, or a year and a half, or 2 years, or 3 years. So if we're going to talk about homelessness and its effect on children's brain development and their early learning, you have to say, okay, what age are we talking about before we start talking about generalities? So what that does is it sets me up to say a little bit about those three concepts that you teed up at the beginning, Dan. So yeah, anyone in the early childhood fields knows we've been obsessed with how early experience affects brain development. for at least the last 20 plus years. And because the environment actually shapes brain development, literally shapes it, either makes strong foundations or it weakens it. But it's not predicting exactly what's going to happen, it's probabilities. But guess what? As you said, Dan, the brain's connected to the rest of the body. So the immune system, metabolic system, so everything about early experiences and exposures that affects learning also affects physical and mental health. And so we have to start thinking about that as much as just later school performance. The second concept here is that place matters, that responsive relationships are important. But those relationships, and as we all know, if we want to help children and help them do better, and let's think about homelessness. So before starting with the children, we have to think about the adults who are caring for them, and because their needs are enormous in a homeless situation. And so we could think about the community context for some families is living in a community where you have a place to live and a whole lot of other stuff going on. And for some people, there is no community beyond the homeless shelter or being on the street or temporarily staying with friends who allow you to stay. So we can't just focus on parent-child relationships. We have to focus on that context. And the third one, that is the one that I really want to emphasize the most in terms of how we think of a more expanded way of thinking about homelessness as not just, oh, this is a terrible threat and disruption to healthy development, but not everybody responds the same to homelessness. So we should stop asking, what is the effect of homelessness on young children? And ask, what are the ranges of effects of homelessness on young children? And recognize that when we're thinking about policies, when we're thinking about programs, when we're thinking about interventions, obviously, all of us are committed to evidence-based programs and evidence-based policies. And we should never be committed to things that have no evidence behind them. But we have to be really careful and recognize that what evidence-based means is that it means it works pretty well for most children and families, but not all. And if we think that just implementing an evidence-based program means mission accomplished, we're missing the fact that actually evidence-based programs work incredibly well for some children and families, on average pretty well for most, and don't work very well at all for some. And so when we think about programs, and I know we're going to hear a lot about programs and things that people are doing in communities, and this is something with all the fancy science, because we know there's variation, we can understand this now at the molecular level. If this is all about gene-environment interaction. So there's a lot of fancy science. But everybody who works in programs and develops policy knows when you're working with families, you know some are doing well and some are not doing so well. Despite what you're doing, it's not working as well. And this isn't a problem with us. It's a problem with this praying at the altar of evidence-based programs is working for everyone and recognizes what happens on the ground is that people in programs who have the training and skills and are paid enough to stay in those jobs modify and adapt what they're doing based on how people are responding. And if we want to even help the general public understand how individual variation, this is the main message I want to give from the science. You ask people, anybody know a family with more than 2 kids? Maybe 3 kids, maybe 4 kids? How about those families who have the same biological parents, live with them in the same place, and ask any family, are all your kids the same? And when something happens that's threatening, every family knows who's the child who's going to be the most sensitive, who's the child who's going to say, whatever. So this variation is an essential part of development. Variation is the norm. It's not the exception. And so the other scientific concept I want to leave you with before we hear from my colleagues is that whether we're talking about brain development or differential outcomes in terms of mental, not just early learning and school achievement, but mental health or physical health, that the name of the game is variation. And so we have to be thinking, we have to expect variation no matter what we do, whether we're thinking about how to prevent problems, how to provide support or intervene on behalf of children living with a caregiver in an unhoused situation. We have to start with an expectation that whatever we're doing is not going to work the same for everyone, that we have to stop thinking about the homeless child as something that has some reality to it, and we have to be prepared and have the knowledge and the capacities and the skills to vary our responses, to kind of be able to tailor what we're doing to meet the individual needs of children. And the last thing I think is obvious to everyone, there's a lot of science behind this, is if we want to meet the needs of children who are homeless, we have to, especially when they're very young, we have to primarily focus on the needs of the adults who are caring for them and make sure that they have the supports to provide the protection and the nurturing and the care that is always where we start. And recognize that a lot of what people have been doing by their gut and a lot of what an average person on the street would think you have to do, how this is an emergency, is a developmental emergency to be in a homeless situation. That there's a lot of scientific knowledge and a lot of on-the-ground experience that we have available to kind of think about how we can really help children get through this. And that would be the last point on the variability issue. Homelessness or other forms of adversity are not a predetermined sentence of what's going to happen for the rest of your life. It's just a matter of increasing the probability of more problems later. It doesn't determine absolute problems later. That's why intervening early is so important. So I'll end with a little bit of a disclaimer. I should have started with a disclaimer. I am not an expert in homelessness. In fact, everybody on the screen here is more of an expert in homelessness than I am. But homelessness is a variation of the fact that the context in which families are raising children is very important and not just their reciprocal interactions. In that sense, the science that applies to many other situations is the same science for homeless situations. There's not a separate science for homelessness. It's just part of a larger context of threats and disruptions that undermine development and health. And how do we prevent them at best? And then secondarily, how do we protect children and help them get through? So I'm looking forward to the other comments and looking forward to the conversation. Thanks
Jack,
for
that's so
letting me
so
be
helpful.
part of this.
I want to get Aaron and Sarah to weigh in on this. But I want to ask you as before we transition. From all of my years working in policy making and with policymakers in the states, one observation that I would share is that very frequently. Policymaking happens in cycles where, there's some decision made, some policy implemented, and that's sort of like, okay, we tackled that. How how do you get and as you're talking with policymakers now in this new role, because I know, part of the impetus for that was that you could play a greater role working directly with policymakers and having conversations about how to really translate this science into policy. How do we best articulate this question of variability? And what is maybe both in homelessness, but maybe elsewhere too? How do we encourage, and what does that idea of recognizing that variability mean for policymakers?
Yeah, oh, that's a great question, Dan. Well, as you know, I mean, all of the work that I've done, if anything has had any impact, it's because I work with a whole bunch of people who are smarter about different things than I am. And some of those things are scientific. I mean, I'm not a scientist, but I learn a lot from hanging around with scientists. But I'm not a communications expert, but I've worked with people who are experts in communication, particularly the Frameworks Institute. And so this notion of how do you make something like variability understandable to people is first you have to understand where they're starting from, and sometimes starting from a situation where you really have to explain something that isn't intuitively obvious to people or is different from what their basic beliefs are. It's so interesting that we find the variability question to be difficult because everybody intuitively gets it immediately. I mean, that's the family example is the one that I haven't met anybody yet who said, I don't know what you're talking about. I mean, we have a bunch of kids in our family and they're all the same. And if you think about the other families, so I think when you can find a way to connect complex but rigorous and credible science that you can trust, if you can connect that to common sense or things your grandmother could have told you, then you're really in business. So actually, I'm kind of perplexed. Well, not perplexed. Nobody has trouble understanding variability. The real question is, why are we so hung up on evidence-based programs without understanding that they have to be flexibly implemented, right? So that's the problem. Every time we do a really well-designed study and come up with an effect size, a magnitude of effect that is relatively modest, everybody goes bonkers and they say, this is crazy. What's wrong with this study? We have much bigger effects than that.
Mhm.
And the answer is you do. You do have bigger effects. But you also, some of the families you're working with and children are not responding as well, and you know that. And there's also a lot of attrition in programs. So the effects that are average are masking reality. Reality is big effects for some and small effects for others. Everybody understands variability once you explain it. And even identical twins, they start out genetically identical, but they may behave in different ways or they may respond in different ways. And so it's that responsive environment shapes your behavior. And so over time, you're very much the same with identical genetics. But you vary as you get older because you're each interacting in a different way in this, in the same environment. So yeah, for me, the question is why does everybody not immediately get it? The answer is everybody does immediately get it when you give them examples of how we're not all the same.
Well, Aaron and Sarah, let's turn to you. I would love at some point in your comments, I'd love to hear your thoughts on sort of Jack's message of one size does not fit all. But as we get going here, why don't we start by giving you just a moment? I would love to have you kind of introduce and provide a little bit of context around the work that you're doing at Schoolhouse Connection, the mission of the organization, and maybe some of the work that you're doing across the country.
Absolutely. Thank you so much, Dan, for inviting us to this important conversation. Thank you, everyone, for joining. As Dan mentioned earlier, I'm Erin Patterson. I'm a senior director here at Schoolhouse Connection. And in just a few moments, you'll hear from my colleague, Sarah Vrabik, who leads our early childhood work. But we thought it would be important to start with Schoolhouse Connection's mission to understand what else we'll share today. We are a national nonprofit organization, and our mission is very pointedly to overcome homelessness through early care and education from prenatal to post-secondary. We say that because lack of a high school diploma or GED is the single greatest risk factor for experiencing homelessness. And so Schoolhouse is committed to ensuring connections to early learning and education are stable when a child or youth housing situation is not. We go about our work in several ways. We work with state and local education agencies, early childhood providers, and institutions of higher education to help them understand not only the legal requirements that do exist for identifying and enrolling children experiencing homelessness, but also the best practices for doing so. And we also advocate at the federal and state levels for policies that remove barriers so that children, youth, and families experiencing homelessness can have greater access to education. And that's starting to get a little bit at that point that Dr. Shonkoff so eloquently made about evidence-based doesn't mean it's for all or works well for all. There are barriers that exist for our homeless children and families. And then I always say the jewel in our crown is our network of young scholars who have experienced homelessness themselves throughout their educational career and who we are privileged to support through scholarship and case management assistance as they pursue their post-secondary education. And just to put a finer point on it, our early childhood work is centered on increasing the identification of young children experiencing homelessness, and then supporting early childhood programs and systems so they are better able to mitigate the impacts of homelessness on young children in those critical developmental stages. And so we thought it would be best to start by defining the prevalence of what we're talking about, homelessness among young children. And for that, I'll turn to Sarah. She's going to share just a few slides and walk us through some data so we have a concrete understanding.
Right.
Thank you so much, Erin. Hi, everyone. I'm thrilled to be with you all today having this conversation. I'm going to take a moment to share my screen. I just have some visuals to walk us through some of this brand new data that we have to share. So for the past 3 years, Schoolhouse Connection has partnered with Poverty Solutions at the University of Michigan to estimate the prevalence of infants and toddlers experiencing homelessness across the United States, as well as their enrollment rates in different early childhood development programs. And so this year's estimate shows nearly 450,000 babies experiencing homelessness across the US. And only 10% of those infants and toddlers experiencing homelessness are served by an early childhood development program. And important to note, this is a drop from 11.5% being served in the 21-22 program year. And so what this means is that almost 90% of the infants and toddlers who are experiencing homelessness across the United States are not enrolled in or benefiting from the early childhood development programs that are specifically designed to nurture their healthy development despite that experience of homelessness. And as you can see on this slide, we were able to receive enrollment data from early Head Start programs, from some home visiting models, and then also for those children who are identified and served by programs administered through their local educational agency. And so in this year's report, which will be released on April 30th, and Schoolhouse is doing a national webinar to accompany that report release, we were able to show an increase in infant and toddler homelessness in almost every single state, including DC and Puerto Rico. And this is while the overall access to housing and early childhood services is actually decreasing. Just last year, the Department of Housing and Urban Development reported a 39% increase in homelessness among families with young children. This is a significant rise, and it's important to note that this is following a 16% increase that was reported in 2023. In this year's analyses, we were also able to show an increase of 84,000 more infants and toddlers experiencing homelessness just between the 21-22 program year and the 22-23 program year. And we also know that only 33% of the federal housing resources that are available actually go to families with children. And a new report from the National Low-Income Housing Coalition shows us that only 1 in 4 families that qualify for housing assistance actually receive it. And so we wish that we could be reporting, a flip in these arrows. We wish that we could be reporting a decrease in homelessness among families with young children and an increase in their access to housing support services and early childhood programs. Unfortunately, that is not currently the case, but it is only when we have this more accurate understanding of the scope of an issue can we then better target our service delivery to best meet the needs of this population. So I hope that this brief data snapshot is enlightening to everyone. And like I said, if you want to dive deeper into the data, learn more about our methodology and recommendations for action, the report is being released April 30th, and we have a national webinar to accompany that report. So you can visit schoolhouseconnection.org to learn more and to register. I will stop sharing my screen now, so we can.
Well, I can tell you for sure we will help you to promote the release of that report. Sarah and or Aaron, I guess boy, I can't help but think, even to the point I was making during kind of my opening comments, one that I think a lot of people may come away surprised at just the sheer prevalence of this problem, that I think this is a much more widespread issue for children and families, I think, than is commonly acknowledged. But it's fascinating to see this data about this increase. Do you have a sense of what was driving that we would have a 39% increase?
It's a great question. There are a number of drivers of homelessness. I think we are still seeing the impacts of the COVID-19 pandemic. And in fact, in some cases, we're just now starting to see the impacts in the data. And so as a reminder, I fielded this question yesterday. The reason our report highlights data from the 22-23 program year is because that's the most recent that's available from the U.S. Department of Education. So we are essentially building our estimates around the slowest system to report their data. Head Start, early Head Start programs, the PIR data is much more recent, and that's usually available at the fingertips as soon as a program year is done. But so it's important to keep in mind that that's an increase from the 21-22 to the 22-23 program year. But I think all the drivers that we all know to be true from our daily lives are reasons why this prevalence has increased. Certainly lack of affordable housing across the country is one driver, but also lack of educational attainment, domestic violence and abuse. These are all factors that play into homelessness, particularly among young children. And so I think that's without any, I'm a fake researcher, as I always say, but without any sort of evidence-based study, that would be my instinct.
Well, and it gets to Jack's point about the needs of adults really playing into this whole question. I want to follow up. I've said now twice that this is a broader problem and maybe a broader definition than people maybe conjure up. When you say the word homelessness, I think many people would immediately think toward people who are, literally having to survive outdoors or in their cars. But the actual definition is considerably broader. As a matter of fact, we have two different federal definitions that are kind of contributing to this conversation. Can you shed some light, maybe, Aaron, on what's the difference between these two definitions? Why do we have two definitions, and might we be better served by figuring out how to merge those into one?
Yes, to answer your last question first, we would absolutely be better served by merging the definitions. Some people are not aware, we do have two different federal definitions. Most people are familiar with the definition through the U.S. Department of Housing and Urban Development, or HUD, which is the more narrow definition. And it defines homelessness as those who are staying in a shelter or who are visibly unsheltered. So if you are in the DC area like me, or Philadelphia like Sarah, you probably do see on a more frequent basis people in tent communities staying outside, sleeping outside on the streets or in shelters. And that's the HUD definition. And the biggest difference is that is who's counted and able to access services. So if you want to access HUD-funded services, housing services, you must fall into one of those two categories. The McKinney-Vento definition of homelessness is broader. It was first passed in the 1980s, the McKinney-Vento Homeless Assistance Act, and it defines homelessness in addition to those two categories, sheltered and unsheltered. It also includes those who are staying in motels or hotels because they have nowhere else to stay, and those who are staying with others, what we refer to as doubled up, and what we have started referring to in the pandemic as tripled up or quadrupled up because the situations have become so dire. In order to, like I said, in order to qualify for HUD services, you must fall into one of those two categories, but most families with young children do not. They are more likely to stay with others rather than staying on the streets or outdoors. And so that means they're not counted in the annual HUD point in time counts. And so when Schoolhouse releases our data on April 30th, it's going to show 450,000 infants and toddlers alone across the country experiencing homelessness, whereas HUD data shows just a few more all homeless across the country. That's because they don't count doubled up and they don't count staying in hotels and motels. It's important to say that those staying with others are just as precarious, if not more so, than those in sheltered and unsheltered situations. Just to paint a vivid picture, this could be mothers sleeping on couches with their baby in very unsafe sleep conditions, leading to SIDS. Could be children being confined and shushed. A 2-year-old should be babbling, but instead they're being shushed because the mother's afraid the homeowner will kick them out at will because they have no rights to the lease. It could be a mother trading sex for a place to stay, or staying in an abusive situation and a substandard living situation, or leaving children in a motel room next door with strangers so that they can go fill out a job application. And these are the kinds of hidden homelessness that don't often get counted. And they are included in the Department of Education's definition of homelessness, and therefore children meeting these definitions are eligible for early education and pre-K to 12 education services. But often not eligible for HUD services. And in fact, school age data shows that nearly 1.4 million children and youth are experiencing homelessness across the US, and about 80% of them are living doubled up. So 80% of our children who are homeless are not seen. And that's important to understand. And because they are deemed not homeless enough, they're often unable to access housing services. And perhaps the most grim recent example of this is from Detroit. A mother was living in a van with her children for several months, and in February, called a homeless shelter to try and get access, and she was told they don't have beds for families because shelters are typically designed for single adult and usually single adult males. 2 of her children died overnight in her van because they were not able to access shelter services. This is dire. It is urgent for us. It is a very, very urgent crisis. And so we absolutely agree that by aligning the definitions at the federal level to that McKinney-Vento definition, then more children and families will be counted and served.
Let me ask you about sort of where maybe there are some bright spots on the solution front. Obviously, states both red and blue are leading on this topic around the country. Where do you see promising practices that are helping either to mitigate against the prevalence of homelessness, or providing really extraordinary service to families that maybe find themselves in that category?
I am excited to share. We have many examples, and I will do my best to concisely tick through them. We at Schoolhouse Connection, we look for policy solutions and practical solutions, both legislative and administrative, that increase access to both housing and early childhood development programs, particularly by removing barriers that families may face. And again, calling back to Dr. Shankow's point earlier about an evidence-based program may work really well for a small portion of families who live in an idyllic situation. But for families experiencing homelessness, they have barrier after barrier after barrier. And so the policies that we've seen that are most effective are those that acknowledge that and offer solutions and better pathways for homeless children and families to access programs. I think I'll start with, there's a lot of places to start. I'm going to start with South Carolina, not because it's mine and Dan's home state, but because this is an example of a solution in the childcare system. South Carolina hired a full-time homeless support and childcare referral specialist, and they did it with existing funds. So they maximized their childcare development fund grant. They created a position whose sole job is to make sure that families who qualify as homeless under McKinney-Vento receive a placement in a high-quality childcare providers program, which we've heard anecdotally, parents tell us, I can't go get a job until I know my child has a safe place to be during the day. And so childcare can unlock the rest of supports for families with children. The Oklahoma Commission on Children and Youth has created a homeless children and youth steering committee, and their goal is to find cross-system collaborative partnerships and opportunities that, again, can unlock more resources for children experiencing homelessness, including by defining the scope and prevalence of the problem through data. Nevada has used their $30 million preschool development grant to prioritize homelessness and prioritize access to services for homeless children. Again, exciting because they're using existing funds and carving out a prioritization for homelessness. And in part, that has led to them revamping their early childhood referral website. It was, unbeknownst to them, designed so that a family has to put in their home address in order to find a program that's closest to them. And of course, if you're a family experiencing homelessness, you do not have one. And then I have to mention the Connecticut Head Start on Housing program. This is a statewide program signed by an executive order from the governor, and it allowed early Head Start and Head Start programs to distribute housing vouchers directly to homeless families, which is important because that means that families in doubled up situations also became eligible. To date, and I'm looking at my notes to get this right, as of late March, 141 referrals were processed, 326 children across 147 families have been housed as a result of that. And that's through the early childhood development system, being able to help families access housing. And then there's also a number of practical examples on the shelter and housing side as well. Even one close to home for us is Sarah, before she came to Schoolhouse, led an everyday learning project that helped family shelters transform their environments to make them more friendly and developmentally appropriate to young children. It's acknowledging that children exist and they are experiencing homelessness too.
Erin, thank you. What a great overview, and exciting to hear how much leadership there is around the country on this topic. I have so many questions I want to ask all of you. Want to turn to Teresa and to hear a little bit from her perspective in San Francisco. As we do, I want to remind you here in a couple of minutes we'll transition. If you have questions for the panel, please again feel free to use the Q&A function down at the bottom of your screen, and we'll get to those questions in just a couple of minutes. So Teresa, we'll turn to you at this point. We're so glad you could join us. It's a little earlier in the morning out in California, so glad you could be here. Let's start maybe with a really a basic question that hopefully can help to contextualize the important work that you're doing there at Glide. Talk to us a little bit about, first, what is a family resource center? And I ask the question in part because so the opportunity to talk about some of the services and the important things that are happening at your own, but also so that those in the viewing audience know that this isn't just a San Francisco thing, right? It's not something that if you don't live in your particular catchment area, that doesn't mean that there may not well be a program very similar in whatever your own community is. So give us a little bit of an intro to what happens at the Glide Family Resource Center, and how might viewers learn more about family resource centers generally?
Absolutely. First of all, thank you so much for having me here, and I'm so excited to be here with everyone on this panel. So the Family Resource Center, we're in San Francisco, and we are one of 27 family resource centers in San Francisco, and we're supported by the Department of Early Childhood. And just to mention, so Glide Foundation provides many different services in the Tenderloin District of San Francisco. And every resource center is placed in a different neighborhood. They may have a population focus, or they may have a neighborhood focus. And we have a neighborhood focus, and we're here to support families living in the Tenderloin, and also we're beginning to support families in Treasure Island. A family resource center is here to support families. We support families 0 to age 17. So we start with parents while they're pregnant, all the way till their child turns 17. And we support in many different areas. If I could break it down, first would be bonding between parent and child, because of course, it's extremely important. And we support early literacy, supporting children getting into early childhood services. And we support the parents. So we actually work with the parents and their children. We do not work directly just with the child. The parent is always present. And our support services go from something that would promote bonding, like we teach infant massage to parents so they can bond with their babies. And then we also offer support groups, parent-child interactive groups, and events in the community, safe events. One thing I want to say personally, in serving the Tenderloin district, is that I want the services that we provide to be exactly as great as the ones in the richest neighborhoods of the city, which we have a lot of. And I want those services and the quality of services that we provide to be the same quality for all children. And we provide basic needs. So this is where we will see a lot of our homeless, unhoused families coming in. We will support them with a variety of things to help them through their journey in trying to get shelter or housing. And they are also enrolled in our programs.
And I'm curious. I'm curious, Teresa, that just sort of piggybacking off of Jack's opening comments about sort of the variability, both in families' sensitivity to different interventions, but also thinking toward what Aaron was sharing about the different definitions of homelessness, variability, and even the situations of the families. How does that resonate with you, sort of from your perspective on the ground working with families? Are you finding a lot of variability in the specific needs of families, maybe under that broader category of homelessness?
Absolutely. I was doing a lot of head nodding during those comments because I'm like, yeah, that's what we're seeing. And also the part of it's not always what we think, someone on the street, like you said, someone in a tent. We have a lot of families, if anyone knows, San Francisco is a very expensive place to live. We have a lot of families living in a studio apartment together or in an apartment with a couple of bedrooms, but in each bedroom there's a family. And our concern is always the mental health of the parent, because we know that that's going to affect the child. So when we see an unhoused parent come in, a homeless parent come in, they are all incredibly different. Some are like, this is a bad time in my life and I'm going to get housing and I'm looking for a job. And we have some families completely shut down. And we have some children that seem to have a lot of anxiety, and we have some children that are just so excited to play when they're here, and everybody's. So how we treat a family is based on them. We meet them where they're at. So we do see a lot of families from domestic violence, as mentioned before here. We do see that because the parent may not be able to survive on their own in San Francisco or maybe any other place. So we will see them. So there's already trauma in that family, and we will support that family with services. We want them to be in the best place possible to be able to take the steps, because if we have a parent that's very shut down, case management and all these services don't really mean anything because they can't really take next steps. So we really see parents from every place and every different circumstance that you can think of. And for any of us, I think how quickly someone can fall into homelessness can be pretty scary.
Well, it's interesting, and I want to get us here in a minute to some of the audience questions. But if I haven't stated it explicitly, or those of you in the viewing audience haven't figured it out, we've sort of structured this hour sort of as we're funneling down from a very big picture, from sort of a child development perspective to more of a policy perspective. But Teresa, you really represent, again, the kind of boots on the ground perspective of working with these families day in and day out. Is there anything that you wish that people better understood about the homeless families that you are working with every day?
Yeah, I think that there's a lot of kindness in the community, and I will mention this because Glide works with unhoused and homeless not just families, but individuals. And there's a lot of kindness in the community, and there's a lot of support between the community. A lot of our referrals are from one parent to another parent saying, I went to Glide, they helped me with this. And then we have so many parents. I met this other parent in the shelter. I met this other parent on the street, and they support each other. So there is a community still within unhoused people. And what I would ask of people is to have compassion, and if you're interested in supporting families, really anything can help. Your time, volunteering or your education in these different areas are just so helpful to families, and they're a wonderful community, and they just need some support to get to the best place that they can be for their children.
Teresa, thank you, and thank you for the work that you're doing at Glide as well. Why don't we jump into a couple? We've got about 10 minutes left until the top of the hour. A couple of questions, Sarah. I think these maybe Sarah questions because they're around some of the data that you shared. One question that I did spot in the chat that maybe I want to lead off on. You mentioned that a relatively small percentage of families who fall into this category are actually receiving the services that that they may be eligible for. Interestingly, that's very similar across many other early childhood programs. For example, the Federal Child Care and Development Fund, which helps to fund child care subsidies. I think the most recent data that I've seen is that only about 14% of even the low-income families who are eligible to receive that service are actually able to access those services, in part because they are underfunded. And so one of the questions in the chat was, to what do you attribute that, the fact that so few children actually get the opportunity to access those services? Is it lack of awareness or lack of funding or something else?
That's a really great question. And I would say it's a combination of all of those answers. One being, in some communities, it is lack of awareness. Sometimes staff within early childhood development programs don't know necessarily the best way to have those kinds of conversations about housing status and living situations with families. And I also saw someone made a point in the Q&A. There certainly are caregivers who are concerned about identifying themselves as experiencing homelessness for fear that their children may be removed from their custody. So in a lot of these conversations, we're relying on trust being built between the provider and the family so that a family does feel safe in identifying as experiencing homelessness, allowing them to be opened up to receiving these kinds of services. And then, of course, yes, absolutely, these kinds of systems are underfunded, and like I mentioned, often rely on that kind of self-report.
And then a related question, Sarah, Cindy is asking in the chat about these numbers. Is it possible that the numbers are underreported? Given that families may have concerns about not being identified within child welfare or child protective services sorts of programs and conversations.
Yes, absolutely. Every single time we present this data, we like to emphasize that these are conservative estimates. First, no community, no state is perfect in their identification rates and in their data reporting. Like I mentioned, it's all about building that trust with the family so that they do feel comfortable in reporting. And then in terms of the data that we were able to present for enrollment rates, we would love to present the number of children experiencing homelessness who attend childcare programs. We've not been able to receive that enrollment data from the Federal Office of Child Care yet. Additionally, we only received data from a few different home visiting models, but even then, many home visiting models collect this data in aggregate, and they don't specifically align how they're asking these questions with the McKinney-Vento definition of homelessness. So we know that there might be some families who are absolutely benefiting from these services, but are not being necessarily identified and counted. So these are a lot of things that we at Schoolhouse think about when we want to improve that data collection and data reporting.
Great. Jack, Kat has a question that I thought you might be good at answering here. She's noting that that sometimes our emphasis in recent years on quote evidence-based programs is almost beginning to feel like a barrier. And she's noting that it depends very much on who the evidence was gathered on and so on. And I think to your point around having policy that is more focused on variability, all of the work that you've been doing on the idea of place-based needs and intervention. She's asking, how can we be part of a shift to more community-based evidence potentially, where communities are leading around what works for them and their children and families?
Yeah, that's a great question, Dan. I think I would start by expanding the definition of evidence and not just focusing on evidence that comes from randomized controlled trials or well-designed intervention studies. But well, all the science we talk about is evidence. It's a different kind of evidence. The on-the-ground expertise and experience of people who've worked in the field, whether it be in home-based programs or center-based programs or community initiatives, is a body of knowledge. We ought to add that to the different ways in which we might define evidence, recognizing that there are different criteria for evidence in different settings. But I think the most important part of this is that people who work in the world of scientific studies kind of have an easier job because their most important product is what's the still unanswered question and what will the next study do, right? And so we make a joke about the fact that more research is needed doesn't really help on the ground, right? On the other hand, we really need good evidence from multiple sources. We need to think about different ways of knowing about a problem and judging each one by where it comes from. But for me, the big issue is whenever you're involved in making decisions about allocation of resources or delivering services or working directly with people, almost always, it's rare that you don't make decisions based on incomplete evidence, incomplete knowledge, right? It can just take you so far. I was trained as a pediatrician in the beginning of my career. It's a lot of evidence-based stuff in medicine, but a lot of medicine is making decisions based on not complete knowledge and information. So I think we can't disregard evidence. We have to recognize how you define evidence. Evidence from a science perspective or an intervention perspective is not, let me tell you about a study that I just read about last week. Evidence is the cumulative knowledge from multiple studies and multiple sources of information. And that's what we might call best practices, right? So best practices or state of the art has to sit on credible evidence, but evidence is necessary, but not sufficient because a lot of the challenges we have, and we've heard a lot about this today, don't have complete, unequivocal, trusted, credible scientific evidence for what the right answer is. It's a lot of figuring things out based on the best knowledge that we have.
Jack, thank you. We've got just a couple minutes. We'll get to as many questions as we can here. Aaron, this might be one for Schoolhouse Connection. Howard is asking in the chat, we talked about examples of leadership in the States. What lessons can we learn from other developed countries that may be further along on this question than we are, places that may serve as examples for us here in the U.S.?
That's a great question, and I will not pretend to have a good answer to it. I wish that my days of comparative international policy were still in full view. I will say, I set up numerous Google News alerts so that we can keep up with what states and local providers are doing. And I saw someone on here from Ireland, and I get a lot of news alerts from Ireland, from Australia, from Canada, UK in general, and from India. And they are all struggling with the same problems around child homelessness as we are. And I don't know what the comparative international solutions are. I know that there are commonalities, though, across how the prevalence is showing up, commonalities around the fact that families with young children are experiencing homelessness, yet housing solutions don't incorporate children. I always say you can provide housing to a family, but that does not mitigate the negative impacts of homelessness on a young child. And so we are, keeping an eye as we can on international solutions. And I invite others to tell us what we should be doing that has worked well in other similar countries.
Yeah, and I'd love to add a comment to
Sure,
reinforce what you just said, because the one thing we haven't talked about, when we think about communities, a larger context, it's not just about services and what the poverty rate is or what the educational levels are. There's an issue around culture and values where people live, and that's where the global perspective really helps, because a lot of this depends upon whether your culture and your values, which differ a lot around the world, of whether, if any family is having a problem in some cultures, it's the community's problem, and people rally around trying to figure out what to do. And in some cultures, like maybe we might identify the culture in the United States as one, it's very individualistic. It's very like, you take care of your kids, I'll take care of my kids. This is self-reliance and all of that. So nothing is pure in one end of the spectrum or another. But there is something about where people live automatically means that you all are always thinking about how you take care of each other, or whether basically most people are going to be on their own. That's part of place matters.
Yes. All right, I will say it pains me to say so, but it is the top of the hour. We have some other great questions in the chat, and selfishly, I would love to continue this conversation, but definitely want to honor our panelists' time and all of yours who have carved out just an hour for our time together today. One question that is in the chat that I want to clarify. I've had several questions asking whether the session has been recorded and whether it can be made available for viewing later. Several of you have mentioned that you'd like to be able to show this to colleagues or share it with colleagues. It absolutely will. We've recorded. It will be up on the Saul Zaentz Foundation's YouTube site. We'll promote it through the foundation's social media channels and my own. So I'm not exactly sure when that will happen, but I would guess probably within the next 24 hours we can have that up on the YouTube. The other question is, are there going to be more of these conversations? And I'm excited to tell you that there will be. This is, again, the very first installment of this Meeting the Moment series. I'm particularly fond of the title. I think, over the years, I have hosted lots of these conversations, and it's interesting, no matter when they occur. Meeting the moment, really resonates, right? That a lot of my work hosting these conversations online began at the height of the COVID pandemic, and that was a particular moment. This is a particular moment, and so will next month and next year. And so, we look forward to bringing you many more conversations around the needs of children and families as we meet the moment, both here in the U.S. and abroad. Again, I'm so thrilled to have participation from all around the world today. Would welcome you to reach out if you have ideas for future sessions, whether they're focused exclusively in the U.S. or not. Would love to hear from you. And with that, let me just take a moment. Panelists, I know how busy your schedules all are, and what I just have meant so much to have the four of you here with us today. Thank you for taking this time, and for all of you who tuned in today, the very same. Thank you for taking time out of your busy schedule to be with us. We'll be announcing the May session here in relatively short order, so stay tuned. By virtue of signing up and participating live today, you'll get notified by email as future opportunities come up. So we look forward to seeing you sometime in May. Thanks again, everyone. Have a great day.
Thank you.
Thank you.